to have you take a little sip of water
Yep.
and hold it back and then gargle with sound.
Okay.
You guys are live.
Oh, jeez. Sorry about that. Everybody looks like a goofball now. All right, so welcome to A Spot for Health. My name is Shirley and I'm your host of the show that tells the community where to go for health in Sun Prairie. And I'd like to invite you to share this show. If you're watching on cable and you'd like to share some of this information with your friends, you can do so by going to ksun.tv and then searching for The Spot for Health, and you'll be able to share these shows. We're going all dental today with our guests from Wisconsin Dental Solutions. We have with us today two people. This is our first two-person or three-person interview with Dr. Peter Lotowski, who owns a dental practice in Sun Prairie called Wisconsin Dental Solutions, right in our little complex there at Primal. And he's dedicated to helping adult patients with complex dental problems. You got a lot of those. His areas of focus are dental implants, dental sedation, dentures, and advanced restorative dental procedures. Dr. Peter is a graduate from Southern Illinois University's School of Dental Medicine. He graduated first in his class of 50, that's pretty impressive, and right after graduation then he moved up to Idaho where they keep potatoes, right?
They're
It's
fantastic.
a big deal, right?
Oh,
Those
yeah.
potatoes up there in Idaho. And he went through a different level of education up there, advanced education, I guess, at Idaho State University in the general dentistry residency program, where he set new records for the program. We're going to ask about that because I don't know what that means. And then, so now he's working on people with missing teeth and less than perfect smiles. He wants to help people regain function of their mouth and help build self-esteem, which we almost never talk about with dentistry, which is huge. He is also married. He has two little kids, and he enjoys spending time with his family and learning new things. He's learning how to do a TV interview today. That's what we're doing today. And he likes woodworking and being outside. And we have with us his hygienist, Lori. Lori, you didn't write your last name on here.
Sherman.
Sherman. Oh my gosh.
right.
I know a lot of Lori S's. Sorry about that, Lori Sherman. She's a registered dental hygienist at Wisconsin Dental Solutions, and she's been practicing dental hygiene about as long as me, 30 years, and finds partnering with her patients on overall health and wellness extremely rewarding and fulfilling. Her interests include, I love this, your number one interest, dental hygiene.
She loves what she does.
Nutrition and wellness, and patient advocacy, which is really huge.
Yes.
Patients seem to really have a really tight relationship with their dental hygienist over their dentist. Hopefully they never have to really see the dentist, no offense.
I hear that all the time.
That's right. So Lori's married and they live in out near Juneau. Beaver Dam,
Just
I'm
with
trying to
Beaver
think.
Dam
Beaver
area.
Dam, near Beaver Dam. So welcome, both of you, with your really long introductions. So
Thank you for having us.
you just bought this practice
Correct.
not
yeah,
too long
recently.
ago, and when was that?
It was March of this year, actually.
Oh, really? So we
But
started at the same time.
I think so,
Yeah.
just about right. But I've worked there for about 2 years prior to that.
Okay. So you know a lot of people already then in Sun Prairie, and you have
I was able to
People
help a
know
lot of
who you
patients.
are.
Yep, I was
Yeah,
able to help a lot of
that's
patients
awesome.
before then, even so.
And Lori, you've been at this, and did you guys change the name of the practice?
No, it's been Wisconsin Dental Solutions.
Right. So you've been there
I helped open the doors.
at that location
Yes.
for over 10 years or
15 years.
15 years. So you've been around quite a long time. So one of the things that you do that's different than a general dental office is you really focus on restoring the health of the mouth, or restoring the mouth's function. I like to separate that from restoring the mouth at a biological level and a microbial level, which is what you and I do, Lori. So you take missing teeth and you replace them. I graduated, as everybody knows, in 1986, and that was right around the time when implants were starting to get a little traction, at least right around here in the Madison area. I shadowed Dr. Rasmussen, who was a prosthodontist, and so that's a person that focuses only on restoring teeth, but you do a little bit more than, you're not a prosthodontist.
No.
No.
I'm a general dentist that has had more experience, more education with implants and more of the complicated, some of the specialties actually. You know, I've had a little experience with the different specialties essentially. And so I'm able to do the whole gamut of dentistry that
So
it has
you
to
can
offer.
do everything, but you really like to focus on the implants and implant retained dentures.
Implants, yep.
Yeah.
Implants, full mouth reconstructions. Basically, we see a lot of patients in their what we call terminal dentition.
Okay.
So when the teeth have broken down quite a ways to where they're past the ability to restore them, and that's when we come in and we help bring their confidence back and give our patients a full set of new teeth to smile with, to eat with, and regain their confidence. And dental implants help do that.
And they do it permanently.
Absolutely.
Can we say permanently? Because most of dentistry is kind of permanent.
They're the best that we have for replacement of teeth. They're the standard of care now, and they have been for quite some time now.
Right, and I like that you brought that term up, the standard of care, because some people still think that that's like Cadillac treatment or Rolls-Royce treatment, but it's really the standard. And if you're getting a partial denture, you know, to replace 3 or 4 teeth, it's really, you know, that's the Beetle stage. That's the motorized bicycle stage of restorative dentistry.
Right. I mean, your natural dentition is not removable. It's not something that you have to take in and out and put on the table or take out at night. It's so having something fixed, having something that's integrated into your jawbone, something that is permanent, is really more like natural teeth. It's the closest thing to natural teeth that we have.
So this has gone, it has evolved a little bit. The implants used to be like they called them a blade implant, right? So it was long, it was almost two-dimensional. It was just, I don't know, was this way, right? But now you're kind of doing tooth by tooth, and we're pretending that the implant is like the root of the tooth. So it's more along those lines. So you're doing those kind, and you don't really do one implant per one tooth. You
We
could
do
help,
that as well.
You do that too.
Yep. So, you know, they've experimented with a lot of things in the past. That's medicine. And the blade implants are not commonly used anymore. The most common is the endosteal implant, which goes right into the bone, which looks like basically a root of a tooth, except that it's titanium. It's just a different material, kind of like you have with a replacement of a hip or a replacement of a joint. It's titanium, which is able to fuse with a bone. And so it kind of looks like a regular tooth root.
Right.
And so you replace those. And the nice thing about them is you don't need as many tooth roots as you need natural teeth to support a full arch.
So let's talk about that for a second. I know that Lori brought us some, because she's an educator, right? So she brought us some pictures to show what exactly it is that we just said. So go ahead. Why don't you kind of explain it, Lori?
So first, we've got a person with a missing tooth in the front of their mouth. And then...
So this is an example of a single tooth replacement. And then we'll show you what a multiple tooth emplacement entails as well.
Here they've placed the implant. It looks similar to a screw, and that's how it integrates with the bone. And then sometimes there's another part that's called an abutment placed on that. And then the crown that matches all of your other natural teeth. So it's fully functional like your normal teeth. You care for it similar to your normal teeth. So it tends to make people the happiest and the most responsive, because having something that has to come in and out of your mouth,
Oh yeah, it's crazy.
it's frustrating and not comfortable. And here, they're not working on the teeth on either side, which used to be the standard of care. They would trim down
Yes,
these
right.
teeth in order to fill in the gap with a bridge. So that's becoming outdated. And there are situations where a person doesn't have the proper structure to have an implant, so occasionally that is a possibility. But
Sometimes you still have to do that.
this
That
is-
was with my mother. She had a tooth removed. I think it was an upper tooth, and she just didn't have enough bone left. So they had to still do a bridge to
Yes.
replace that tooth. But I was talking, it's interesting that you showed the picture of the front tooth. I was talking to a friend of mine the other day who had congenitally missing teeth in the front. So not the
Common.
straight front teeth, but the side teeth were not there. And in the old days, we had to use what we called a flipper, right? So they had pretty much a denture. It would take up the whole palate, and it would have two little white spots that would supposed to be teeth, which never really looked like teeth. I don't care what kind of an artist you are.
Absolutely.
But now she has implants, and so she has two implants that replace those teeth. You can't tell that they were anything but her natural teeth. And she flosses them, and she takes care of them just like regular teeth.
They look natural.
Yeah, they look really nice, actually.
You know, Shirley, we have a lot of patients come in, and they come in with either a missing tooth, having a flipper already, or they come in with a tooth that is pretty broken down past the point of saving. You know, you can do a lot of things to a tooth to save it.
Right.
But what is the prognosis going to be? And so you have to think of that and determine what's really more valuable and what's better long term. And so having a single, what we can do is take that tooth out the same day, put an implant in, and attach a temporary tooth. So you're walking out with a smile and something that's already attached, something that, not a flipper,
Right.
something that is already attached and you don't have to take out.
So I just heard you say that you could take the tooth out and replace a tooth in the same day, in one appointment.
Absolutely.
Not like I do half of it in the morning and the half of it at night.
Nope.
Wow, that's pretty amazing.
it is
I
amazing.
like that.
So you
People
can-
love it. And that's
Yep.
one of the biggest reasons they seek us out.
Because you can do it. So is this an all-day appointment then?
No,
No?
it's really a quick procedure. It takes about an hour. You come in, we basically work on a tooth, we replace it with the implant, and then we attach a tooth that looks exactly like the old one that you had. And if you didn't have one, we make one that looks like your adjacent teeth,
Yeah,
and you walk out smiling, and there's very minimal discomfort.
yeah. Awesome. Well, that's, and then that bone fills, what's unique about the material now is that the bone fuses to that piece of metal.
Absolutely.
And are there occasions when there's an allergy to that metal?
Almost none.
I don't know of any cases where that's happened.
That's very, very rare.
Yeah.
Well, that's why it's
Not
such a
seen.
common material to be used.
Right.
They use it in your knees, in your hip replacements, the shoulder replacements.
Absolutely.
So it's all over the place. Well, that's awesome. So that's one tooth, and that's really important. And you can put two teeth onto one implant?
Sometimes you can.
Yeah.
Yep. So you can replace multiple teeth with implants as well. And Lori's going to show you what it looks like to replace multiple teeth.
Okay.
So say you have a side missing. Say you have like a lower right side that you're missing. And so instead of doing a partial, something that you'd have to take in
Yeah.
and out, you could put 2 or 3 implants in that side and support all the teeth on that side. And so again, it's something that's fixed, something secure, something that you don't have to worry about coming out of your mouth.
Right. So does it have the same limitations though as a bridge then, where you have to clean underneath those teeth then, if you were to do it that way?
You clean it like you would your natural teeth. The benefits of an implant is that they don't get cavities.
Oh, well, there you go.
So you
That's
don't.
a plus.
Yep. So you still want to maintain, you still want to clean. That's the best for implants. You can use a water pick to get underneath. There's lots of tools that you can use to help clean around implants.
Excellent. All right, so why don't you show us this next little, so this is a person that had all of their teeth removed.
All of their teeth are removed.
And is there a time limit? So is this like those teeth were removed last week or last year or 7 years ago, or is there a time?
So there's multiple ways to do this.
Okay.
So say one patient comes in that has a denture that they're not happy with.
Right.
The denture is loose, it constantly comes out, they don't feel confident with it. What we can do is we can attach, so say this is an edentulous area. What we do is we place the implants. We let those implants integrate into the bone. They wear their denture in the meantime while everything is healing.
Okay.
And then once it's healed, we attach a fixed denture to it, fixed teeth.
Fixed denture.
Fixed
so
teeth.
Not taking them out and
Correct.
in every night.
It's attached. It's attached.
Nice.
It's secure. You don't have to worry about taking it in and out.
So when a patient has that, go ahead with your next. So okay, there you go.
So that's one scenario. The other scenario is, say a patient comes in, like we spoke about with the terminal dentition. So they come in and their teeth
I'm gonna write that down.
Go
ahead.
Their teeth are broken down, and there's very few teeth left. And so what's happening is that those very few teeth that are left are having to work even harder because we still have the same kind of chewing capabilities with our muscles. And so that's putting even more stress on them. And a lot of these patients are unable to eat, don't feel like they can smile, or embarrassed, they cover their mouths.
Right.
So that's very common. And so what we do is kind of like we replace a single tooth in a single day and put a tooth on it. We can do the same thing. So what we would do is take out the remaining teeth, prepare basically, prepare what we need to, and then put our implants in the same day and attach a denture to that right away.
Oh, okay.
So you walk or attach.
You still walk out with a completed
You walk out
smile.
with a new set of teeth right away that's attached and that sits above the gum line so that it's very comfortable. Our patients report very little discomfort with it. And they're actually surprised. They're actually surprised how quick the procedure was and how comfortable they feel.
I can imagine now that you just said that there's no, you don't get cavities in fixed teeth, dental fixed teeth like that. So does that mean they never have to come back to the dentist? Does it get loose? Does something happen? How often do they still have to come back?
Very good question. Lori, you want to talk about that one?
Sure. Actually, it'll vary on the patient and in their dexterity abilities. So we have some people who come in every 3 months.
Even with a denture?
Even with this.
Oh, nice.
Because
okay.
some people just naturally don't have the skills with their hands, the ability to brush really well.
Right.
Or to get that water pick at the right angle to get things cleaned out. But I have to say that water pick is a master tool with implants because it can catch food particles and people love it. They just love how
using it,
it blasts stuff out of their thing too. And so they'll come usually between 3 and 6 month visits, and they'll come for a regular dental hygiene visit like they would when they had their natural teeth. and I will go about cleaning the prosthetic, the implants. It'll seem similar to their cleaning appointments before, and then the doctor's also going to come in and do exams.
Right.
We do x-rays to make sure and check the health of those implants.
Right.
We want to make sure that the bone's nice and healthy. It's not a slam dunk that doesn't need care ever again. It's still a part of your living tissue. So you really
Sure.
want to take good care of your gums and your bone. So you got to keep the infections at bay and keep your mouth nice and healthy.
Well, I think that's what used to happen with our denture patients back in the olden days. They would get their teeth and you'd never see them again until the teeth were super loose or the denture was loose, and then they'd want some other kind of reline, I guess is what I'm trying to say. And in the meantime, there are tissue changes that happen. For one, if there's no teeth, the bone disintegrates or the bone atrophies and disappears. So the implants stop that process from happening, which is another really good selling point. But we need to do an oral cancer screening on people, even if they don't have teeth.
Yes, absolutely. So important.
So did you bring us samples of the dentures?
Yeah.
We did.
You want to show the fixed one, Lori?
Oh, so this is more life size.
They are. So this is a sample, and you can see on the underside, that is how it attaches to the implants in the mouth. So this is one that'll be put in the mouth permanently. It's called a fixed appliance.
And that's lower teeth.
This is lower teeth. And so from the top we go in and that's literally screwed in, and then the person, it looks natural and it's made to match their complexion and if they have upper teeth, it matches everything, same size, shape, color, that type of thing. It's a lot of artistry involved also.
Right.
So people love it. It's amazing. There's a little bit of a different feel to it because the implants are bonded to the bone versus your natural tooth has a ligament that has a little bit of give to it. So that's the one thing that people do notice, but in a sense,
you get used to it,
you do, and
really
it's
fast.
a sense of security and confidence, actually.
Oh, well, there you go. It's all the spin, right?
Well, it's important.
How you look at it,
it's not flopping around and getting loose when you're eating or talking. That's a huge thing.
What we see, the reaction that we usually get is, people come in with the broken down teeth and they're not happy with the color of them, they're not happy with what's left, they're not happy with the smile. And then the first thing after they have this done, they look in the mirror and they smile and they say, wow.
Yeah.
The new color, which is what they picked out, and it's been customized for them.
They're like life-changing moments.
Yes.
I mean, we have a lot of tears.
Yeah.
Tears of joy.
Happy tears,
It's crazy.
It is so rewarding.
Was just going to say, there's a lot of physiological change that happens when you smile. And if you spend half of your life doing that and not smiling because you think your teeth are bad, that's not good systemically either. It's not just about the teeth themselves. So that's an important feature. And just being happier and being able to eat better is also important. So have you noticed anything along those lines with your patients as well, where their diet has changed so dramatically that they're healthier, that they can chew, a carrot? Not everything is mashed down or whatever.
That is one of the biggest benefits of having fixed teeth. It's not something that's moving around in your mouth while you're eating.
Right.
And so it's attached, it's secure. You can bite into things, you can chew things up very well with it, compared to something that's loose and moving in your mouth. You already have the food that's moving in your mouth. Now imagine
It's so hard to keep track of everything.
Now imagine just having a denture which just sits on the gums that is just moving about as well. So there's a lot of things to control at the same time. And that's how that's the benefits of the implants. You put 2 of them in, they help secure a denture. You put 4 of them in, they can help. It's like 4 legs of a table.
Right.
It's very sturdy. It stays in place very well.
Mm-hmm.
And you put enough implants, it can support the full dentition.
The full dentition.
Well, and the nutrition is so important.
Oh, yeah.
Because as we age, you know, a lot of people are single, and so they're alone, and they don't want to cook.
Right.
You know, and they start gravitating to these simple foods and fast foods, and then they're soft, mushy foods.
Right.
And so they're not getting the nutrition that they need. And they're very adaptable. They just get used to it over time, and they don't realize that they're not getting the nutrition they need until finally, you know, something happens, they're at the doctor, and they get tested, and they find that all out.
No wonder you're sick, right?
Exactly. And then frequently they're just like, well, what am I going to do? You know, and so then that's when we get to see them, and we get to place some implants, and they have a whole new world of function to be able to eat raw vegetables instead of mushy vegetables, to eat an apple or corn on the cob. Yeah.
The Sun Prairie Corn Fest.
It
is
is.
all about that. Well, you know, and I do want to make a comment about the chewing, and that the lack of chewing that's happening just in general has been causing a lot of problems in children. It stops the maxilla from growing. Obviously, we're not talking about children, but not chewing also makes the muscles in your face atrophy.
Absolutely.
And your tongue, and you can't taste food as well. So all of those things are really critical for overall health.
And things can collapse that way, and you know, not benefit you getting air in and breathing in. Yep.
So it's really it's important work that you're doing.
Digestion. You know, we were talking about nutrition here.
Yeah.
Where does digestion start?
Well, it starts right behind the lips.
Absolutely.
You know, I often complain about all these books talking about the microbiome of the digestive system. I'm like, dude, it starts here. You need to be able to chew. So if somebody is interested, what's the best course of events? We have like a minute or 2 to go. So they call your office or drop in, or?
Well, we invite you to check out our website.
Okay.
We have 2 websites, dentalimplantsmadison.com and Dental Solutions, the number 4, YOU, dentalsolutions4u.com. And feel free to give us a call. We do free consultations where we can tell you about what you can have done and what's available to your specific situation. So we invite everyone to come and talk to us in our office and give us a call. Phone number 608-834-6321.
Terrific. And then if they don't need implants and dentures, you're still accepting new patients.
Absolutely. We do the full gamut of dentistry, and we offer the IV sedation so they can have dentistry done very comfortably.
Well, that's awesome. So now in the last like 30 seconds, what's the difference between DDS, which is what most of the dentists around here have because they came from Marquette or University of Iowa, and DMD?
There's really no difference. A lot of the programs that were DDS are kind of switching to DMD. It's Doctor of Dental Medicine because it entails so many things.
Right.
It's not just Doctor of Dental Surgery, because it's really dental medicine. It entails the whole body.
And there's more and more evidence to support all of that.
Yep.
So here we go with the end of our show. Thank you so much for joining. I know, it goes really fast. Thank you so much for joining us. This is Shirley Gutkowski, the host of Spot for Health, signing off. And feel free to share the episodes, as I mentioned. And now you know where to go for your dental health in Sun Prairie.